Hello, this is Dr. Scott Warner, the Municipal Health Officer for the City of Cullman, and I'm coming to you to bring you some additional updates as to the current status of COVID in our community and the world. I'm hopefully answering some questions that you have that will help bring some clarity. The opinions that I am expressing are based on medical fact and do not necessarily represent those of the hospital administration. As I mentioned in a previous video, there are a few side effects of the COVID vaccine. I'm not going to stand up here and tell you that it's perfect, but it is certainly the most effective way of preventing illness and death that we have. That is unquestionable. 99% of people hospitalized or dying with COVID are unvaccinated. That statistic alone would dramatically bring attention to the measures of this. We have seen some side effects of the vaccine that are reported. I was shocked to see a post by someone who is strongly anti-vaccine saying there's 30,000 people who've died from the COVID vaccine. And I couldn't believe that that was being posted. So what is the situation? I mean, is the vaccine killing people? Really? Is that the case? So let me give you facts. Again, I don't have any reason to misrepresent this. I'm not a representative of the vaccine industry. I am here to provide factual information that will help you make an informed decision. So looking at this information, first of all, where is this information stored? So for all vaccines, there is a vaccine adverse event reporting system, VAERS, that is available for every vaccine out there. So if anyone has an issue with a vaccine, their physician can report it, and if the FDA sees this, they can begin investigating whether there's a trend. If someone has a serious side effect from a vaccine, it is almost always within 3 months or less of receiving the vaccine. For people who are out there saying, I'm waiting to see what happens before I get the vaccine, there's no need to wait any longer. The safety of the vaccine is continued to be proven with some small amount of adverse events, but not a lot of death related to the vaccine, and let me explain that. So this VAERS was opened up to the public with the COVID vaccine in the interest of transparency. And so anyone can look at that information, but it's not factual information, it's just reported. And second, anyone can report anything to the VAERS. In fact, if you received the vaccine, you know that you had an option of getting a little link on your phone, and they would send you a questionnaire every few days. How are you feeling? Are you having any problems? And you would just input this. So all that information was going in. So there's a large amount of information in there. And so what do we know so far? So from the time in mid-December when vaccines became available until just a few days ago, there were reported about 6,000 deaths, which is 0.0019% of all vaccines given. Now, what is important to realize is that anyone can report this, but it does not mean that those are linked. The VAERS system is not a system of cause and effect. It is simply a reporting system which is then used to investigate. So every single one of those reports will be investigated by someone who will look at the medical record of the person who reportedly had an issue. They will look at autopsy results, if in fact an autopsy was done, and do a very thorough investigation. So for example, if an elderly person who is on hospice with a terminal illness receives the vaccine, and then it's reported that they die, it goes into this system. Now, it is unlikely that the vaccine caused their death, as you could imagine. However, it would appear in that number. But again, even so, with all those cases that are proven not to be related, it's still an astonishingly small number, 0.0019%. Contrast that with the chance of dying of COVID by itself of about 1% and the chance of being hospitalized with severe COVID of about 20%, and many of those people will have lingering issues for a year or longer. So again, if I was a bookie in Atlantic City, I think I would take those odds pretty easily. But is it perfect? By no means. What are the issues? Long-term side effects of vaccines have not been seen. Most cases, if anything, would be within 3 months. So we had those cases. 339 million doses of vaccine were given to 187 million Americans up to the point of this information that I'm sharing. But again, the number of deaths reported is exceedingly small. So they did look at this, and they found that there are probably 3 deaths total that were likely related to the vaccine, and those because of the J&J vaccine, the people developed blood clots. Now that we know about that, we are recommending that particularly women in their childbearing years to potentially avoid the J&J vaccine, or if they do so, they should be careful of any potential clot situation. And now that we know about it, blood thinners and other things can be given very promptly and hopefully prevent any future deaths. So that really is, after all of the cases were thoroughly vetted, then the number of deaths reported to the vaccine are extremely small. Is it okay to take over-the-counter pain medication before or after getting a vaccine? We generally recommend that you do not take any anti-inflammatory medicines such as aspirin, ibuprofen, and things like that before the vaccine if you can prevent it, because we do want your body to actually produce inflammation, which is meaning that the vaccine is producing a good immune response. If you have severe allergic reactions, can you get the COVID vaccine? Again, if you have life-threatening allergic reactions, speak to your physician before you get the vaccine. Also notify the vaccinator. You will be monitored for 30 minutes, but it does not mean you should not get it, but you need to speak with your physician. Depending on what type of allergy you have, it may not be an issue at all, because the things in the vaccines are very few, and so unless you have an allergy to PEG, which is polyethylene glycol, your chance of having an allergic reaction is small, but still important, and we need to know about that. Can I get the COVID vaccine if I have an existing health condition? In fact, yes, and please make sure that you do, because people who have pre-existing health conditions are, in fact, those are the ones that are the most likely to develop severe problems. Can pregnant or breastfeeding women get the COVID vaccine? If you are, you may choose to get the COVID vaccine. Research is ongoing, but there is no sign at this point that there is any serious threat based on the safety monitoring system. You would obviously want to speak to your obstetrician or primary care physician about that. Again, remember that mRNA vaccines do not alter your DNA or cause genetic changes. That is absolutely untrue. And so no harmful events have been found in people receiving the vaccine. In fact, in the trial that was done, placebo versus real vaccine in pregnant women, there was 1 miscarriage, and it was only in the placebo group. So again, it does not affect women's fertility. That is old myth that has long since been disproven, but continues to be spread as one reason for people avoiding it, which is unfortunate. Not only does it not affect your fertility, it does not affect the pregnancy and health of your baby. We do know that the antibodies that the mother produces are found in breast milk, which will then go to the baby and protect the infant from infection itself. So you may wish to, in fact, be vaccinated, certainly in discussion with your obstetrician. What if you've already had COVID? Do you need the vaccine? Again, if you had COVID, you probably had the original COVID. We are now dealing with the Delta variant of COVID, so you may certainly become infected. And we also know that the amount of immunity that you have is dependent on how severe a case you had. So if you had a very minimal or mild case, even asymptomatic case of COVID back in the fall of last year or the winter of this year, you may find that you, in fact, have very little immunity. And if you do have it, it only lasts for a period of several months. So you may become reinfected, and so we don't know how long your protection will last, but the protection from the vaccine is stronger and longer lasting than the protection that you have from your own infection. So yes, having had the infection is still recommended to get the vaccine itself. Can you get COVID-19 from the vaccine? You cannot. There's no virus in the vaccine, and you cannot get sick with the infection from a vaccine itself, but you need to still be aware of that. And I do know of cases where people who come get the vaccine, in fact, I got a call not too many minutes ago before taping this, that someone who just got the vaccine yesterday is now sick and tested positive with COVID. They did not get COVID from the vaccine. They already had COVID but didn't know it at the time they received their vaccine. And so if you do test positive for COVID after the vaccine, you truly have COVID. It's not because of the vaccine. You cannot get a positive test or get COVID from the vaccine. So if you are tested positive, you do need to take it seriously and isolate as normal. If you have symptoms of COVID, even after having a vaccine, you need to be tested because you potentially could also have it. Is the mRNA technology new, unproven, unsafe? Again, this is also a misunderstanding. The mRNA technology has been in development for nearly 2 decades. Although this is the first pandemic we've had to produce a vaccine of this nature, it is not the first time that technology has been explored. The beauty of it is that there is no germ going into you, and it can be rapidly produced and distributed, which is one of the beauties of why this vaccine was able to be brought out in such a timely fashion. Again, Operation Warp Speed was meant to bring a vaccine in short time. However, no safety steps were skipped. You may certainly review that information yourself, but the fact that it came out quickly is not a negative thing. Much of the red tape was done by the government so that the companies producing it would not have any financial loss if the vaccines were not approved. Therefore, they went ahead and started mass producing them even before it was approved, so that if it was not approved, they would not be out any money. They would just throw it all in the trash. But the government knew that the mRNA technology was so favorable, so safe, and so quick that they felt the risk was worth taking, and so far that has proven to be the case. So don't let the speed at which the vaccines were produced fool you. It's because of the technology and the assistance of the government trying to save lives that it came out so quickly. Again, look into the facts. You'll find that it is not unsafe or rushed through. That is totally incorrect. What about ingredients in the vaccine? Again, this is what's in the vaccine, okay? A tiny amount of sugar, a tiny amount of fat droplets which protect the mRNA, and then the polyethylene glycol. There is no fetal tissue in the vaccine itself. There are no microchips. There is no tracking devices. There are no implants. That is all myth and a way of keeping people from getting the vaccine. Just a story from my own experience in the last few months, which makes me extremely sad, is I had an elderly lady who came to see me on oxygen with a walker coming into the clinic, and I asked her about her vaccine, and she insisted she was not going to get the vaccine. When asked why, she explained that she knew that they were going to put a tracking device in her, and so she would not do that. Now, she doesn't go anywhere except to the doctor because she's essentially homebound. And even if they did track her, which is physically impossible to get a microchip the size of a red blood cell through the eye of a needle, I asked her, what would they have to track you for? Even if they did track you, what would it matter? But at the end of the day, she chose to believe rumors and Facebook rather than her physician, which is unfortunately the trend that we're seeing over and over. Very discouraging when medical experts will try to give good advice, but people will insist, no, I'm not taking it. I don't trust it. But suddenly if they get sick, then all of a sudden they do trust the doctor to save their life, which really makes no common sense. But unfortunately, that's the era we're living in. I would encourage anyone who has not been vaccinated to please review the facts. The facts are unquestionable. The vaccine is not perfect, but this is not a minor illness that we're talking about here. This is a fatal illness, a pandemic which threatens to kill many more people. If we continue on the track that we're on with the Delta variant, we expect the number of cases to surge to even more than what we experienced by March of 2021. Which will mean many more hospitalizations and deaths and permanent disability in people. And so the risks and the benefits clearly point towards vaccination. Please wear a mask. Please be vaccinated. Please be courteous of others. The vaccine is helpful, and the mask prevents you from spreading it to others. If you choose not to be vaccinated, I assume you're going to wear a mask at all times because you are potentially a spreader, and you would not want to give it to somebody who then either gets sick or then spreads it to someone else who dies. You don't want to be in that chain. So please make a wise choice. Look at the vaccine information. Get one if you haven't already, and wear a mask if you're not going to. Thank you for your attention, and we hope with God's help we'll continue to get through this. Thank you.